Welcome to Integrated Health of Indiana, and I'm Dr. Trevor Miller, and this is Nurse Jessica Miller. And we want to talk to you just a moment about what is root cause medicine. And so I have my take on it. Jessica, actually, her take on it is very similar. I'm going to let her go ahead and talk about the root cause medicine and an experience that she is having. And then I'm going to talk a little bit more about it and talk about where we're lacking in our healthcare system. Go ahead and you talk about root cause and what you're doing to discover your root cause.
An easy way to think about root cause is kind of comparing it to like the traditional medicine, which traditional medicine usually is treating symptoms and not problems.
Well, let's qualify.
Symptoms such as...
Well, why do you know about this?
Oh, because I'm a nurse.
And how long were you a nurse for?
I worked the floor for 12 years, so a lot of times it's just the nature of the beast that we were just chasing symptoms because we really didn't have time, or insurance doesn't pay for the testing, and there's just not a lot of... Doctors just don't have the time to just really dig into each patient's case, typically in most environments. So for root cause medicine, we don't treat the symptoms. We treat them as we are trying to figure out what the problem is that's causing the symptoms, and then take care of the problem so you no longer have the symptoms.
So think about root cause medicine, like if your car doesn't start. Is it the spark plugs? Is it the gas? Is it, what are the different things? And so let's take the example of it's not getting gas. So you can open up the hood and you can start the car by squeezing, well, not nowadays, old cars with carburetors. You could put gas in the carburetor and make the car start. And you would still have the problem of gas not getting from the tank into the engine. And so that's kind of the symptom. We want to get down to, okay, why isn't the gas getting from the gas tank to the engine? Is it the fuel pump? Is it a leak in the line? What is that cause of the problem? And so symptoms like weight, depression, fatigue, digestive issues, hormonal issues, whether they be hormonal issues for not being able to get pregnant, to not being able to maintain a pregnancy, to guys having erectile dysfunction, to women having PCOS. The idea is to get down to what is causing the body to malfunction, because when we're born, unless you are born with a genetic defect that you have pretty much from birth until now, pretty much everything that develops has a cause, and you have done something to allow the triggers to activate and cause whatever it is. So in my family, it's Alzheimer's and dementia and diabetes and those types of things. Her family has autoimmune issues. And we've both seen how they want to just go to the person and say, hey, you need to take this, that, and the other pill, and it'll help modulate what you're having. We can't really reverse it, and we'll check on you again in so many months. Most things are reversible. I say most things. I'll go out and say all things are reversible. We may not know how to reverse them yet. And so, because of the way genetics are, when you turn something on, you should be able to turn it off. If you are expressing diabetes, if you're expressing metabolic dysfunction through the form of diabetes, you can absolutely reverse that. And you can reverse metabolic obesity, you can reverse all kinds of things. And that's what we mean by getting down to the root cause. So here at Integrated Health of Indiana, we do 3 tests to start your journey on developing or discovering those root causes and getting rid of them. Want to tell them about the tests?
Yeah, and we've done this over time, so we've just kind of narrowed it down for us. So we get a beautiful picture, snapshot in time, so we require that they all be done at the same time because they kind of overlap, and then that's where we start from. So we actually start treating immediately instead of, well, it could be this or it could be that. And well, piecemealing is what we say. So we have 3 tests. They each do something different within, test something different in the body. So the first one is our GI map. That is a stool test. That tests for dysfunction in basically your gastrointestinal system, and that looks for bacteria overgrowth, viruses, parasites,
Bacterial imbalance, digestive.
H. pylori, which is inflammation of the gut, and it
digestive
puts
juices.
a few more things in there, and they're always updating that test. So that one's kind of fascinating, but that's a stool test. The second one is the omics. That's an organic acid test that uses plasma, which we draw with the blood to get that, and then it uses urine. And that tests your nutritional status.
Well, it does nutritional status. It lets us see if you're having problems with stress because there are stress markers or inflammation. It lets us look at your neurotransmitters. So if you're depressed, if you're anxious, if you have these types of issues, we get to see the brain chemicals in there that cause that and start to help you produce those again. Looks at the mitochondria and how the mitochondria are doing. It is a fascinating, well-rounded test, and it gives us a lot of insight as to how you work metabolically. The GI map, as she was talking about, is like, going back to the car analogy, is like looking at the car. Does the car have all the parts that it needs to run? And the omics test looks at, okay, well, we have these pieces of the car. Are we getting the right exhaust? So that we know how things are running. Is it running too rich? Is it running too lean? And then the last test is our Dutch test, Dutch Complete.
Which I love this one because that's my passion is hormones. So hormones to me is just everything. And that one looks at your cortisol levels, which looks at how you're sleeping, what kind of stress you're under, looks at your sex hormones. Are you producing them? Are they being sent the right direction? For men and women, that's different. How much you have, how little you have, all kinds of fun stuff.
And so that really starts the whole program. And the way the program starts with our root cause medicine stuff is we do those 3 tests, and you will start an elimination diet. So just be forewarned, if you're looking at this and you're thinking about this, we look at your habits, we look at sleep, we look at your stress, and if you're not willing to change, don't waste your time or your money, don't waste our time, because we just want those people who are willing to really dig into what is causing their dysfunction.
Well, and ready.
And they really want to change this stuff. So that allows us to get in there and start to do that. And we start with the elimination diet. The elimination diet will show you. We have yet to have anybody that does the elimination diet.
No, they usually do fabulous.
That doesn't start to improve their symptoms. We track you with what is called a multiple symptoms questionnaire, and everybody, bar none, has gotten better.
And it's not easy. So don't think you're going to walk in and it's going to be easy because you're going to get a prescription or a pill or whatever. This is hard work, mostly on your part, but it's absolutely worth it.
We make it easier because we guide you through it. And we've done this now for years. And we are opening it up to the internet. That has opened up our ability to help more people. So that is root cause medicine. Root cause medicine is getting down to what has activated the genetic triggers that are causing your symptoms and now starting to reverse those. Thank you, and we look forward to helping you heal from the inside out.